years into the Global Action Plan on the public health response to dementia, we are still so far from achieving its targets. We have made that point in our plan to impact reports 1 to 4, and we are glad that the WHO today makes a very important call to all governments to remind them of this important commitment. We hope it will not go unheeded, and we will make sure to remind individual non-compliant governments at every possible opportunity to heed the report recommendations. It is a cause of concern that so few governments are yet to contribute data to the Global Dementia Observatory. In the absence of this data, monitoring their progress becomes incredibly difficult. It is only thanks to ADI members, many in this room today, that we are able to keep the finger on the pulse of what is really happening in every country. The report makes very important recommendations. For example, on the need to strengthen education of the healthcare workforce, which is now more important than ever. It also reinforces that for every 14 studies of non-communicable diseases, there is only one in the field of dementia. This is a worse ratio than the comparison with the report in 2018. There's so much work to do. One final word of warning is on COVID-19. Our estimates are that 25 to 45% of all people who died of COVID-19 had dementia. But there are grayer clouds ahead of us. As we have reported widely yesterday in our latest press release, there is growing concern in the neurological and psychiatric community about the links of long COVID with cognitive deterioration. We have a very concerning time ahead of us. I cannot stress enough to all WHO member states the importance of being on the front foot in what post-pandemic of dementia ahead. Our community was hit by a tsunami in 2020. People living with dementia, their family and carers worldwide deserve a better life. Please, no more delays. Let's put our resources together and make this change for good happen. Thank you.
Thank you, Paola, and thank you to ADI and its members across so many countries, keeping this prioritization of dementia high on the agenda. This is very much appreciated.